Do you want to know why marketing and sales are so important in dentistry? Hi, I'm Dr. Herman Gomez and I'm in Valencia, Spain. And today we will talk about the importance of marketing and sales in dentistry. You will learn how to create awareness. You will get to know your marketing options and the truth about our business. You can have the best service or be the best trained dentist in the world, but if nobody knows, what's the point? Everybody should know about that. You can be as good as you want. If nobody knows about that, you will not be successful at all. So you need marketing and you need to sell your services so that everybody buys it, so that you can help everybody. Okay? Awareness of what you do, of who you are, of where you are, can come from many sources, including advertising, search optimization. That means if somebody looks you up on Google, for example, so that you go first in line, okay? You appear the first. That's search engine optimization, SEO. It can come from referrals, it can come from online marketing, it can come from traditional marketing. Awareness can come from word of mouth marketing and word of mouse marketing. So it's online. Everything is online. So people speak about you, but not from person to person, but they post it in internet. We have several options how we produce awareness. These marketing options are here summarized by Chris Heiler in landscapeleadership.com. And we can divide more or less the diversity of marketing in free and in paid marketing, in online and offline marketing. So there is online free marketing, online paid marketing, offline free marketing, and offline paid marketing. Let's talk about the online marketing. The free marketing is all the social media you have. You are on Facebook, on Twitter, you are on Instagram, you're on TikTok, and so on. Okay? And YouTube. All this is social media. And what you post there, you spread the word about you. Okay? And it's free. Now, also email marketing. When you send emails to your patients, it's also free. Then online paid marketing is search engine optimization, pay-per-click. So your advertisement comes up in a Google search. And if the person that searches does not click on your advertisement, you don't pay. Okay, so that's pay-per-click. You only pay if the person clicks on the advertisement, which leads him to your website or to another landing page, whatever. And to build your website, you also have to spend money. So it's not free. Then offline marketing is all the publicity and PR you can do. So speaking, writing, featured stories in newspapers and radio, in TV. The problem is to get into these places for free. Usually you need a publicist and that costs money. Then referrals are free. Networking is free. And your community work you can do is also free marketing for you. Now, paid offline marketing would be advertisement in print, in broadcast, direct mail, and so on, sponsorships, networking in a professional way, like the BNI, like Business Network International, and all the expenses you have for your branding. So, Fred Joyal, the guy from 1-800-Dentists, he knows so much about the dental industry. He said once, patients who get what they expected return. Patients who get less than they expected, they leave your office. They never come back. And patients who get more than they expected, They refer to you. So you want definitely patients who refer other patients to you. In order to do that, you need to give them more than they expected. Okay. Now you have to change your mind. You have to change your mind in how you see your office, how you see your business. Look at the pictures below. What are we? Are we a medical facility, health clinic, a repair shop for teeth? Below you can see a woman, most probably in a remote area, that is getting an injection from a dentist. And you can see right next to it like a dental chair, dental equipment that is portable. You think these dentists go to these remote areas to make veneers or a bleaching? Of course not. They do what is purely necessary, and there are two things that are purely necessary: remove teeth and make the pain go away. Okay. Everything else is elective. Everything else is elective. So a filling is elective. Root canal treatment is elective. A crown, a bridge, even a denture is elective. Okay. So all that is not necessary to take away a tooth or take away the pain, all that is not necessary is elective. So we have to inform about that. Everything beyond distraction is elective. And we have to inform patients about everything, including bleaching, veneers, fillings, everything. Okay. Now, we are in a business of retail service. Dentistry is a retail service profession. Okay, that's also a definition of Fred Joyal. And that's why everybody in the clinic has to be selling dentistry. Everybody in the clinic has to inform about dentistry. Okay, so selling something good is not bad. You might think, well, I'm not in a selling business. I'm a dentist. I treat patients. I do something good. I don't do something bad, which is selling. But selling is not something bad. Who told you that? The perception is there that selling is something bad, but it's after this course you will see it's nothing bad about. There is nothing bad about selling. Okay, selling this is something bad. Okay, but what you are selling is treatments that help people to enhance their health. There's nothing more ethical to do in life. So please, but if you don't sell, you cannot help. They will not buy from you. They will buy from somebody else. And people need to be talked into what they should do. Always. Everybody knows that he or she has to have a healthy diet and work out. Everybody. But they just don't do it. So you have to talk them into be healthy, into work out, into going to college. You have to talk your children into studying and all that stuff, which is good. And this is sort of sales. You do it every day. Now, when it comes to lifestyle, bleaching, veneers, for example, is a lifestyle enhancer. Okay, that's not even not necessary. It's beyond not necessary. Okay, but people don't need that. But people want that. This is a big difference. Now, people will pay, and you have to know that, or find a way to get the money for what they want long before they pay for what they really need. Let me give you an example. How many Michael Kors bags. Does a lady really need? How many does she want? How many does she pay for? Same thing with shoes. How many pairs of shoes does a lady really need? How many does she want? How many does she have? Okay, so everybody who wants something will find a way to pay for it. Now and people want not veneers, they want a beautiful smile. Okay, and this is what you have to tell them, that they can get that beautiful smile with certain treatments that are right for them. Okay, but only if it is right for them. You have to find out how, with questions. We get to this point later in the course. So it's very true. When it comes to utility, they want the cheap. When it comes to lifestyle, people want the best. So let me explain to you. You buy socks, okay? You go and buy socks. Most of the people in socks, they don't look at the brand really, okay? Most. But more and more people, if they buy a suit or a tie, they want an Armani suit or a Hugo Boss tie, whatever. Okay, so in these things, they want, in lifestyle things, they want the best. They want quality, they want a brand. But when it comes to utility, they want the cheap. Now, the problem is people perceive you as a utility. So dentistry for people, for the people's mind, is a utility. So they think they compare apples to apples if they compare the different dentists, which is not true, because some dentists are more specialized in aesthetic dentistry, for example, and others are more specialized in putting implants. Okay, and if you consider yourself one of the good ones in what you do, you have to make people see that you are one level ahead and you're not a utility. You're a lifestyle for them, a lifestyle enhancer. And with lifestyle enhancers, you can raise your prices and people will pay for that if they see you as a lifestyle enhancer. Now, what's the value of a new patient? Well, based on a country where the final price of a full ceramic crown, final price for the patient of a full ceramic crown is 380 euros. Okay, that means the dental technician takes between 100 and 200 euros, okay, for this full ceramic crown, and the final price for the patient is 380. Based on that, the calculation is that the value is up to 21,000 euros. You can see that in a video that I made about how to calculate the value of a new patient. Look it up. It's also in another course I made. But you need the marketing to get this new patient into your office. Now, why marketing and sales are so important? Well, because I believe strongly that you did not finish dental school and said to yourself, wow, finally I can be a mediocre dentist. I think you told yourself, finally I can learn more and try to be one of the best dentists in the area. And this information has to be transferred to the patient. If not, the patient cannot see the value in you, and you will not be able to sell the treatments that you want to do to him. I hope this video was helpful for you. Thank you very much for your attention. Please subscribe to this channel, click on the bell, turn on notifications, like this video, share this video, and comment below. Bye.